All right, let's talk about something huge in the world of cancer care. We're diving into a new tool for prostate cancer that's completely flipping the script, turning this long, anxious waiting game into a truly proactive fight. I want you to think about this for a second. What if you could know, like right away, not months down the line, but almost instantly, whether a cancer treatment is actually working? That's the game-changing question we're talking about today. And believe me, the answer could change everything. Okay, so first up, the 6-month waiting game. To really get why this new tool is such a breakthrough, you have to understand the problem it's solving, and it's a big one. All right, so a key piece of this puzzle is something called PSA, or prostate-specific antigen. It's basically a protein they measure in your blood. Now, if you start a treatment and that PSA number drops, and I mean drops fast, that's a fantastic sign for long-term survival. It's kind of like a progress report for your body, telling you if the treatment's getting an A+.
But here's the catch, and it's a huge one. Doctors have to wait for up to 6 months to see that drop in PSA levels. 6 months! Can you imagine? That's half a year of just waiting. It's this massive, stressful window of uncertainty for everyone involved.
And this waiting isn't just stressful, it can be downright dangerous. Listen to what Dr. Soumyajit Roy, who was the first author on this study, said. He pointed out that for patients who aren't responding well, that delay gives the cancer time to grow, to get stronger, and to become even more resistant to other treatments. The stakes are incredibly high.
So what if you could just get rid of that waiting game altogether? Well, that brings us to the hero of our story today, a brand new predictive tool. So get this, a team of researchers has built and tested a tool that can predict how a patient's body will respond to treatment, and it can do it at the time of diagnosis, like from day one. And this is the real deal too. It was just published in a top-tier journal, Nature Communications.
I mean, just look at the difference here. The old way, you wait up to 6 months and just hope for the best. The new way, you get a prediction right at the start. It's a total shift from being reactive to being predictive. It's about knowing, not just waiting.
And here's why this tool is so much better. It's not just looking at one piece of the puzzle, like a patient's initial PSA level or how much the cancer has spread. No, this model is smarter. It's like a detective that looks at all the clues together, a bunch of different clinical factors, to create a way more accurate prediction.
So you can see how this changes the whole mindset. We're going from reactive to proactive. And Dr. Daniel Spratt, the senior author, really nailed it with this quote. He said, "The whole point is to stop waiting around to see who fails therapy. Instead, you can figure that out from the start and create a proactive, personalized plan right away." It's a total paradigm shift.
Okay, so proactive and personalized sound great, right? But what does that actually mean for a patient? Let's break down what this more personalized path looks like. Well, for clinicians, this tool is a game changer. Right off the bat, they can identify patients who are at high risk. That means they can have much more direct conversations about what to do next. Maybe they need to consider a more intense treatment from the get-go. And for the patient, it leads to better shared decision-making because you have more information. It even helps scientists design smarter clinical trials. It's a win all around. All right, so this is all incredibly exciting stuff. But a new tool in a research paper is one thing. Getting it into hospitals is another. So let's talk about the next critical steps. So, what's the game plan? Well, it's pretty clear. Step 1, you have to prove this model works in the real world with real patients. Step 2, you start weaving it into clinical trials to see how it actually changes outcomes for the better. And step 3, the really cool part, is to make it even smarter by feeding it more data, things like genomic info, molecular data, and advanced imaging. The potential there is just massive. When you step back and look at the big picture, this is about so much more than just one cool tool. What this research really does is give us a whole new framework, a new way of thinking about how to help patients with the most aggressive forms of prostate cancer live longer, better lives. And that really leaves us with one big question, doesn't it? By taking this anxious, months-long waiting period and squashing it down into a single, data-driven decision right at the start, are we actually seeing the beginning of truly proactive cancer care? I mean, for real this time. The future will tell, of course, but it sure feels like we're on the cusp of something huge.